Kidney failure, spiking fever, breathing difficulties. Any theories? Am I in an M. Night Shyamalan movie?
Your house, right?
Okay, I assume you know me because I once insulted you, your patient, or your relatives. If that's so, I apologize. I was drunk that day. Patient initially presented with crush injuries.
I know you because Dr. Cuddy issued a memo.
Telling you to cooperate fully with me?
No.
I figured that was a long shot. Anybody here not get that memo?
Fungal infection.
Don't you have a patient?
She shot herself in the leg while high on meth. Wouldn't hurt her to be in pain for a little while.
Fungal infection would be in her eyes by now.
Hemophilus.
Doesn't explain the remitting fever. You've heard that I've got a job opening, right?
I just care about people. Acute respiratory distress syndrome.
ARDS doesn't explain anything, except the breathing. If you care about people, you're not getting the job.
I was lying. Crush syndrome.
Doesn't explain the breathing. What was the problem with ARDS?
Only explain the breathing.
And the crush syndrome?
It didn't explain the breathing.
Are you a fan of symmetry?
Sure.
Weird. Because your eyes are lopsided. And by eyes, I mean breasts. ARDS and crush syndrome. Both reactions to severe trauma. Why can't you have both?
Because then there's nothing we could do.
Boy, you remind me of someone. Send me your resume. I'll put it on top of the pile that I'm never gonna look at. I couldn't leave. You don't seem like the type of person who would give up on giving up.
I love her.
You loved somebody. Somebody who didn't drink, wanted to have babies, wasn't miserable.
I know she lied, but...
What are you doing? Why are you saying these things to him?
The woman you love doesn't exist. This woman is dying. She has acute respiratory distress syndrome and crush syndrome. Her body's basically giving up. We can keep her on supportive dialysis and hope for the best. Never mind. She has a lump on her arm.
Does that mean you're wrong?
That would be good news for you guys. We'll know after the biopsy.
Which patient is that?
Megan.
House's patient.
Yep.
Didn't you get my memo?
Sure. Got both memos.
And the second memo said to ignore the first memo?
Yeah. Seemed odd. Did an MRI and...
Of course you did. What'd you find?
It's kind of freaky.
She's got growths all over the place.
She's got tumors?
Not exactly. The growths are eosinophilic granulomas. They are usually from allergic reactions. So I'm putting her on steroids.
Allergy to what? She doesn't have allergies.
We don't know. Unfortunately, the only drug she's had enough of to have this kind of reaction is cephalosporin.
And why is that unfortunate?
She was on it 2 months ago. That's what you mean, right? She took it for strep throat, so she can't be allergic to it.
It would seem so.
What is this hospital doing to her? She has had 3 separate medical disasters, and now she's dying of an allergy she can't possibly have.
Mr. Lee, just have to check. Sam, are you okay? What are you doing here?
I was taking a nap until
Where's my patient? You stole my patient.
You kidnapped my guitar.
Give him back.
Only when you give her back.
It's a she.
Well, it's certainly not a dude.
It's a guitar. You took a human being.
Well, now who doesn't have a sense of humor? I'm monitoring the guy remotely.
What are you, listening for the distant sound of screaming?
The nurses know to call me.
They don't know who he is.
His name's right there on the chart. Now go away, I'm working.
They give him the wrong meds. Who the hell knows what's gonna happen? House.
Bad things would happen. He's in room 318.
What are you giving Megan?
Megan? Nothing.
Nothing? What's going on? What's wrong with her?
Her? Nothing.
Then why are you giving her drugs?
Just some amphetamines to wake her up. Everything could be explained by her lying to you. The antidepressants, the drinking, the pill. Until now. Now she's allergic to something the chart says she's not allergic to. That's not her lying, that's the chart lying. Which doesn't make sense. Do you know Liz Masters?
No.
Yeah, she worked with Megan. That was her boyfriend you met outside the morgue.
Mm-hmm. This is her chart. She's on MAO inhibitors for depression. She's on the pill. She had an abortion a month ago. And she's allergic to cephalosporin.
What's going on? What are you saying? This isn't Megan?
Yes.
Ben,
Since when?
since right before I began pretending I loved it.
She's the same size as Megan, same build, same hair color. They were both horribly injured, unrecognizable. EMT teams do not second-guess family members' identifications at accident scenes.
No. Liz died yesterday. This isn't Liz. I know Megan. I know her hair. I know her hands. I know her smell, Bob.
What's her name?
Oh, God!
Your girlfriend never lied to you.